Well, I hope you came here to find out what a clinical lab scientist is. So, essentially, me. A clinical lab scientist, this is like the definition off the top of my head, is basically a laboratory professional who runs diagnostics on different specimens so that you can have some type of treatment options. We provide those results to a medical professional like a doctor, someone's a nurse practitioner, and from there they figure out how to treat the patient based off the results that we provide them. Now, this is where it becomes TMI, but it's a critical part of the profession. Now, the specimens that we get is sometimes snot, spit, poop, pee, blood, bones, amputated pieces of your body, eyeballs, depending on if you're like in a hospital or if you're in a clinic or a hospital. Hospital gets all the gruesome stuff. Now, people that's going in for surgeries, you'll get placentas, you'll get stillborn babies. There's a lot that you can get in the hospital, and I've worked at both of them. I also want to mention that a clinical lab scientist isn't the only title for this profession I'm talking about. You'll have the medical laboratory technologist or just medical technologist, medical lab techs. Those are the different options for essentially the same role. The education will be different. Also, when you're getting certified, the certifications will be different. Like, technically, I've gotten clinical lab scientist roles with that title as a molecular biologist. Like, I'm certified as a molecular biologist within the medical laboratory world. And basically, a molecular biologist does everything DNA. Like, I'm able to analyze DNA and then basically say what pathogen is infecting this patient, such as like viruses, bacteria, fungus, and all that. And not only that, you can look at someone's DNA and determine if they have a specific cancer gene. So everything DNA is me. Yet I've worked in micro, I've worked in chemistry, hematology, urinalysis, and I'm not even specified in those different departments, but I've gotten those roles just because I'm specified in one. So they know that as a scientist, if you're specified in one, you'll be able to figure it out. And that's exactly what I've done. And it has been a very rewarding career. And I essentially want to come on here because I have not found a me in these laboratories. It is very much hard to find a Black American woman whose grandparents are from the 4, 5, 6 generations of grandparents are from America in these laboratories. I get a lot of Filipino people, I get African Nigerian people, I get, just all of these different ethnicities and not enough of us. Mind you, all I did to enter this field in Texas was have a biology degree. So I got my bachelor's of science in California and moved out here immediately after graduating and was able to like land a role, not immediately, was able to land a role in an infectious disease laboratory where they were paying me $15 an hour. It was disgusting because there was urine, poop, people's snot. It was all type of crazy stuff. Mind you, when I first got into the profession, I've never heard of it. There was no world that I was in that literally dealt with laboratory diagnostics. So therefore, it was like a new environment, but I loved it because it was like this secret field that provides you with so much information. And I want to be able to reveal that because to other Black American women, just to let you know that with a bachelor's degree, you can do so much. And specifically with this field, I can't tell you about the other fields, but specifically this one, yeah. And then not only Black women, Black men as well, because it was hard to find my cousins, my cousins in these laboratories, the Black men and the Black women of America. Yeah, so essentially, this field didn't pretty much take much to get into it. Just my bachelor's of science, which is in biology with the emphasis in cells and molecules. Real nerd. Um, yeah, so with that, I was able to land my first job in an infectious disease laboratory. I worked there for a year, and after working there for a year, you're eligible for certification. If there's multiple channels to get to the certification, but essentially, if you're someone who didn't go to a program that specifies in laboratory diagnostics, you can work at a laboratory for a year and then apply for a pathway to take your exam so that you can be a certified profession in said field. Yeah, so I had did that pathway, and then after that, the financial opportunities opened up. So my next job after that, I was able to get $27 an hour, and then ever since then, every new job that I've got has increasingly paid me more. Every new job that I got after the previous one has paid me more. And that's when I was able to step into the six-figure business of things when it comes to laboratory diagnostics. This again is only with a bachelor's degree. So I hope that helps someone, anyone, everyone. Yeah, so that's what a clinical lab scientist is. Those are the opportunities that you get as a clinical lab scientist. Those are the specimens that you'll run across as a clinical lab scientist. And those are the financial opportunities that you're able to get. Also, the eligibility requirements as a clinical lab scientist. So I pretty much covered a lot. If you have any questions, please let me know. And I am just starting out my channel. It's called Rough and Pink, and my name is Terry. And do whatever you need to support me. The likes, shares, comments, whatever. And if there's anything I need to work on, also please let me know. I am open to critique.